I recently made a video about the essential medical tests that you should consider before you say I do, and I got a lot of DMs via my Instagram asking me to elaborate more about the blood group and Rhesus factor incompatibility. The video is here. So blood group and Rhesus incompatibility is a very crucial topic, and it can affect mainly pregnancy and blood transfusions if this is not identified quickly and managed properly. In this video, we are going to discuss and understand what blood group and Rhesus factor incompatibility means, how these two affect the child during pregnancy, and the medical steps that are taken to ensure the safety of the mother and the child. So let us start with the blood group, or sometimes known as the AB incompatibility discussion. What you have to know is that the blood group system is comprised of 4 main types of blood groups, and these are based on the presence of the antigens. Antigens, we have A and B on the surface of the red blood cells. So the types of blood groups we have 4. These are the A, B, AB and O, and sometimes they are presented in the genotype form, which is if you have blood group A, you're AA or AO. If you have blood group B, you are BB or BO. It is still the same thing. So naturally, our immune system produces antibodies against the antigens that are not present on the red blood cells. Let me explain. So if you are a person who has blood group A, you have A antigens and you have anti-B antibodies. So this means that a person with A can give you and you will not fight that blood, but a person with B cannot give you, because now you have anti-B antibodies that can fight a person with a B. And remember, if a person has type B, they have B antigens and anti-A antibodies. So A cannot give B because A is going to be attacking B, and then also B cannot give A because B is going to be attacking A. I don't know if you have understood this. Let me just say it plainly. If you're a person with blood group A, you have antigens A and you have anti-B antibodies. And if a person with blood group B, you have antigen B and anti-A antibodies. If you're a person with blood group AB, these ones have antigens A and B, but they do not have antibodies. So that means a person with AB can receive from A and can receive from B, because for them they're not going to fight. They do not have any antibodies that are going to fight these two. We are getting somewhere. Then if you have O, these ones do not have antigens, but they have anti-A and anti-B antibodies. That means A, B and AB cannot even try to give this one. That is also one of the reasons why you have to be very, very careful when there is transfusion of blood from one person to another. A person with A, you have to know that who are supposed to give you. A person with B, you have to know who are supposed to give you. A person with AB, this one is okay, but you also have to be careful, because there is also that minus and the positive. So you have to be careful. Then there is also O. These ones have to be even super careful. If you have blood group O, you have to be super careful, especially if you are O negative. I'm going to explain that shortly. There is something called the antigen D, and it is a protein that is present on blood groups. So it is responsible for the presence or the absence of the plus and the negative. So if you have the antigen D, your blood group is going to appear as A positive. If you do not have it, it's going to appear as A negative. Same thing with B. If you have the antigen, it's going to be B positive. If you do not have the antigen, it's going to be B negative. So another thing you should keep in mind is that people with a negative on their blood groups cannot receive blood from people with a positive on their blood groups, because people with a negative on their blood group, for example, A negative, they don't have the antigen D. That means the antigen D is foreign to them. So you have to be very, very careful when you are transfusing blood, or even when you find out your blood group. Know which people are supposed to give you blood. But your healthcare provider will always help you with that. So, and that is the reason why the negative is the one that is always attacking, because the antigen D is foreign to it. So if they give you your results and you're seeing A negative, A positive, you now know. If you have the A positive, that means you have the antigen D. And if you have the A negative, that means you do not have the antigen D. So you have to know which people are supposed to give you blood. So now let us see who are the donors, who are the recipients, who can give who blood.
So we have our blood groups. We have whom they can receive from and whom they can donate to. We start with A positive. A positive can receive from A positive, A negative, O positive, and O negative. The reason why A positive can receive from A positive is because they have the same antigens and the same antibodies, so there will not be any reaction. A positive can receive from A negative because A negative is compatible with A positive via antigens. Although A negative has the absence of the Rhesus factor, which is the anti-D, it is okay. However, A positive cannot give A negative because A positive is coming with the antigen D, which is foreign to the A negative, and that is the reason why the negative is always the one attacking. If you have A negative, this one here is the one that is always attacking because the D is foreign to it. However, for it can give what? A positive. So the people who can give A are these ones here. These ones here. And of course, A positive can only donate to A positive and AB positive. The reason I've already said it here, same antigens, and also here same antigens, but this one even doesn't have antibodies, so it cannot even react to that blood. So we go to A negative. Now A negative can only receive blood from A negative and O negative. I already mentioned the reason. Then donating, it can donate to A negative, A positive, AB positive, and AB negative here. Then we go to B positive. B positive can receive blood from B positive, B negative, O positive, O negative. Just as I mentioned, the reasons here, the same reasons that we can give here. Then B positive can donate blood to only B positive and AB positive. B negative can only receive blood from B negative and O negative, but it can donate to B negative, B positive, AB positive, and AB negative. Go to the O. These ones, first of all, are called the universal donors. The reason why they are called universal donors is because they can give to everyone but only receive from O. So these ones are the universal donors. However, one of them is the true donor. Let me explain. We have first of all the O positive. O positive is going to receive from O positive and from O negative. O positive is going to donate to O positive, A positive, B positive, and AB positive. Only positives you've seen here. It's only giving only the positives, but it can receive from O negative. But the O negative can only receive from O negative. The O negative can only receive from the O negative because of the absence of the antigen. So it cannot receive from the positive. It only receives from the O negative. And people, if you are O negative, please know yourselves. Know yourself. If it means creating a WhatsApp group in that district, in that village of yours, know yourselves, because these people are the ones that end up having issues. These are the people that we are normally looking for blood for. I have been in situations where you call the district, you end up going to another district looking for O negative. So these people, please know yourselves. Know yourselves. However, this O negative can give all. So all these blood groups, A positive, A negative, B positive, B negative, O negative, can give all. So this is the true universal donor. Then we go to the AB. These ones are universal recipients because they can receive from all. However, they cannot give all. AB positive receives from all, as I already mentioned. So everyone here, if you are A positive, A negative, B positive, B negative, you can give A positive. However, this A positive can only donate to AB positive. Can only donate to AB positive. When you come to AB negative can receive blood from AB negative, A negative, B negative, and O negative. Because of the negative here, However, the AB negative can donate blood to AB negative and AB positive. So these ones here are universal recipients because they can receive blood from all but can only give themselves. These ones are very lucky, very, very lucky. But now, I already mentioned, if you know that you fall here, O negative, mwezule, find each other. Now this one goes out to fathers because I've seen a lot of DNA issues in the past. This is the simplest way for you to know if what they are tying on you, if what they are actually telling you is actually true, because some blood groups cannot make other blood groups. Now, for example, for me, I'm A positive. My mom is blood group O and my dad was blood group A. My sister is blood group A and blood group A. My brother is O. You're seeing something here. Let me explain it for you. Okay, so the first example, let me give you ours. Me, my dad was blood group A, which is AO. My mom is an O, which is OO. So if you cross them, this is going to be AO. That means there's a possibility of the first child being any child being an A. Second, we have AO. Third, we have OO. Fourth, we have OO. That means these children, the children that these two have are going to be blood group A and O. So if there is a child here that has a B, if there is a child that has an AB, thank you so much for looking after the children of the country. That child is not yours. As a father, if you too have these blood groups, you shouldn't expect a B or an AB. Your kids should be A and O. So another example is if your dad and a mom, if your dad is a B and your mom is an O, we are having a B, we're having another B, we're having an O. Oh God, what is this thing? Another O. So here your children have to be A and O. If you get a child who is AB, thank you so much for looking after our children. So how does blood group incompatibility affect pregnancy? This occurs mainly when a mother is blood group O and maybe her partner is A, B, or AB, because the child can inherit any of the blood groups, and most cases they take A, B, or AB. The reason why this is common in blood group O is because these individuals produce antibodies against antigen A and B, which can potentially cause the mother's immune system to attack the baby. So if there is any trauma or anything that causes the blood of the baby and the mother to mix, the mother is going to produce antibodies that are going to cross and enter into the placenta and attack the baby. So the immune response results into destruction of the baby's red blood cells, leading to hemolysis, that is the breakdown of the red blood cells of the baby. So the blood group incompatibility impacting the baby, you will notice that the babies are born with jaundice. This is the yellowing of the skin, the eyes, and sometimes if you look into their mouth, you will notice that it is a little bit yellow. This occurs because the baby's red blood cells are being destroyed. So they will release bilirubin, a yellow pigment that accumulates into the baby's body faster than the liver can process. Also, other cases, healthcare providers are going to notice neonatal anemia. So the baby may appear pale, may appear a little bit weak. This is because the red blood cells are continuously being destroyed by the mother's antibodies. Then, of course, there is also hemolytic disease of the newborn. This is going to happen as long as the mother's antibodies continuously attack the baby's red blood cells, and it will lead to other severe complications. For example, severe jaundice. It will lead to liver enlargement and also brain damage if there are excessive levels of bilirubin in the baby's system or body. So what you have to also note is, unlike the Rhesus incompatibility, blood group incompatibility can affect the first pregnancy and is not progressively worse with the other pregnancies. Let me explain. The mother's immune system does not become sensitized in the same way as it does in the Rhesus incompatibility. Now, in the Rhesus incompatibility, the body has never encountered what is happening. So what does it do? It will take some time to produce the antibodies. And when this thing returns, the body is like, wait, that is a foreign body. Because the immune system was sensitized, it created a memory around it. So when it comes back, the body is familiar with it because it created antibodies around it and it is going to attack. But with the blood groups, for them, they react immediately. They don't have that time of we are going to produce antibodies. For them, remember, the immune system naturally creates those antibodies against the antigens that they do not have, so they are naturally there, so the body is going to react immediately. That is the same reason why when they give you wrong blood, the body reacts immediately. So with the first pregnancy, the body is going to react immediately. It's not going to wait. And if it's the next, the third, the fourth, the body is still going to react to them, because for them they don't have time to we are making antibodies. They naturally have the antibodies. Then also, future pregnancies with the same or different blood group are going to face the same risks, not increased risks. So if again a mother with blood group O conceives a child with blood group A, they're going to face the same risks. So the child will face jaundice, face anemia, may face liver enlargement, and all other problems that have come with the first pregnancy. So there will not be an elevated risk. The child again will face the same risks. And then, let me say this mother with blood group O has a partner who is a B, and then maybe she conceives another child who is a B. That B will also face the same risks as the baby of blood group A faced. So there is nothing like for you, your blood group B, you're going to face this problem. Before your blood group A, no. As long as the mother is blood group O and she has conceived a child who is A, who is B, who is AB, the child will face the same risks as all the other pregnancies. So there is nothing like this one. Is this one they'll face this? No. That is what that statement meant. So unless blood group O is taken with blood group O, mother O, father O, they will have O babies and there will not be any reactions. But if love leads you to A, B, AB, and you as a woman, you are O, please be careful. Avoid causing trauma. Avoid knocking yourself, unnecessarily knocking yourself, or maybe you're walking, you knock it. Avoid trauma to your tummy. And put on flat shoes. Don't put on high heels that you're going to have risk of falling down. Put on flat shoes that are comfortable so that you can easily move around. Husbands, men who beat up their wives, you're doing a disservice to us. You may be angry in that moment, but you would have solved so many things if you just walk away. So if you beat your wives, you risk causing trauma to that baby, and you risk the mother and the baby mixing blood. Please learn to love your wives the way that Christ loved the church. Remember that a man who finds a wife finds a good thing and finds favor with God. So make sure that you treat your wives like the queens that they are, not only during pregnancy, but even afterwards. You people, a woman who has decided to have a child for you, that woman is risking her life. Do you know how many women die in labor? She's risking her life for you, to bring life into this world, to bring a child that is going to have your lineage, that is going to carry your name forward. So respect your wife, love them, so that we do not have these problems. Lastly, the risk of complications is normally managed by monitoring, close monitoring of the baby's bilirubin levels, because as I mentioned earlier, that if there are high levels of bilirubin levels in the baby's body, you risk brain damage if this is not treated. Then there is also early treatment of jaundice, as this is detected in the first 24 to 48 hours and is normally treated using phototherapy. Phototherapy helps to break down the excessive bilirubin so that the body can extract it easily. Of course, sometimes there is transfusion. Remember, I mentioned that there is sometimes neonatal anemia, so there is blood transfusion if it is needed. Follow-ups are very important so that we can keep the bilirubin levels in check or under control. So in conclusion, with the blood group incompatibility is, if you know that you are a mother and your blood group is O, you either stick to blood group O, or you have to be honest with yourself and say, hey, I love this guy, his blood group A, his blood group AB, his blood group B, and you have to be careful. Another thing is you have to be as honest as possible to your gynecologist. With blood groups, it can be managed if detected early. So when you go for those premarital counseling, when you go for those testings before you start having kids, and you meet your gynecologist,
Be honest. Be honest so that you can have healthy children. So let us go to the rhesus incompatibility. Now with the rhesus incompatibility, the rhesus factor is a protein that is present on the surface of the red blood cells. By now we know that the protein we are talking about, the antigen D. So people with this protein are rhesus positive. So your blood group is going to appear as A positive, B positive, AB positive, and O positive. And people without this protein, their blood groups are going to appear as negative. A negative, B negative, AB negative, and O negative. What you also have to know is that this rhesus factor is inherited genetically from our parents. So either parent can give it to you, either your father or your mother. Now, people who do not want to check their blood groups, listen to this very, very careful. So if you are a woman and you are rhesus negative, meaning your blood group is A negative, B negative, AB negative, or O negative, make sure the man you are settling down with is also a negative. So how does the rhesus incompatibility impact pregnancy? When a rhesus negative woman gets married to a rhesus positive man, there are high chances that their child is going to be a rhesus positive. So this is going to result into the hemolytic disease of the newborn baby. When I talk about hemolytic disease, this is when the mother's immune system attacks the baby. And this typically happens because the mother's blood has been sensitized to a rhesus positive blood. So how does the mother's blood become sensitized? First of all, what is sensitization? Sensitization is just a matter of exposure. You, like your body being exposed to something. So how does a mother who is a rhesus negative get exposed to rhesus positive blood? The number one and the most common one is during childbirth. This is the most common, especially if there is trauma. So during delivery, if you've been pushing your baby and maybe you get a tear, the high chances that the baby's blood and your blood are going to mix. Another point is if you've had a miscarriage, an ectopic pregnancy, or an abortion, that mother may have been already sensitized or exposed to the rhesus positive blood. Another point is blood transfusion. If there is mismatched blood, even if this person is not pregnant, but they're rhesus negative and they're by mistake given rhesus positive blood. That's why I said when I was explaining in the blood group incompatibility, you have to know these rhesus things. You have to know if you have an antigen or you do not have it. Because if you do not have this antigen D and they give you blood that has an antigen D, most cases is you're going to react to it. And during these situations, even if you're not pregnant and your blood has been exposed to the rhesus positive blood, your body naturally is going to produce antibodies against it. And guess what? When you become pregnant, these antibodies are going to attack your baby faster because you've already been sensitized to this blood. So sometimes also these invasive procedures like amniocentesis and also trauma during pregnancy may cause the fetal blood of the baby to mix with the mother's blood. So how does the rhesus incompatibility affect pregnancy? So let us discuss the first pregnancy. In most cases, the rhesus negative mother has not yet been sensitized or exposed to the rhesus positive blood of the baby. So her body, her immune system is going to take time to develop the antibodies against the antigen D. So during the first pregnancy, the first baby always survives. The first baby is always conceived and they're carried to term because there are no antibodies. And another thing, the mother has not been exposed to anything, so there is nothing to fight until during childbirth. Remember, I gave you examples of how a rhesus negative mother is exposed or sensitized to that blood. So during childbirth, we can never predict what is going to happen. You never know what's going to happen. In most cases, there is trauma. You may get a tear or something, and blood is going to mix. So when blood mixes, remember the firstborn has already passed. You've already delivered this baby. However, the baby's blood has mixed with the mother's blood. And now the mother's blood has been sensitized. So it is going to produce antibodies against the antigen D. And the body is going to wait. You people, God made this body. It is going to wait until you have your second pregnancy. With the blood group, we say that for it reacts immediately with the first pregnancy because for it already has the antibodies naturally already there against these antigens. with the Rhesus incompatibility, for it the first pregnancy is safe because the antibodies are not there to fight it. They are not, the body is not sensitized, not exposed, it doesn't know this thing. So there is nothing like fighting. The first pregnancy is going to go well. However, with the blood group, for it, it's going to react immediately. First pregnancy, second pregnancy, third, like that. But this one, the Rhesus incompatibility, first pregnancy, the baby is going to be fine. They will create the antibodies for you. Wait for the second pregnancy, and then that is where we are going to start hearing recurrent miscarriages. So once the mother has been sensitized or exposed to the Rhesus positive blood group, automatically there's going to be risk for future pregnancies and the babies to come. So when the mother becomes pregnant for the second time, the body's immune system is going to attack the baby immediately or faster, because now the body has been sensitized. It knows this foreign body. It is like when you see antibodies. What are antibodies for? Antibodies help you to fight foreign bodies in the body. So when the body sees a foreign body there, it doesn't care if it is your baby. It's not that the mother hates the baby. It is not that you want to get rid of it. The body is seeing this as a foreign body, and it is going to attack. It is going to fight. When you see a foreign body, what do these antibodies do? We have to fight and get this out. So that is where you're going to hear recurrent miscarriages unless the mother takes medical steps. So the mother's antibodies, by now we know them, that is the anti-D antibodies, can cross into the placenta and destroy the baby's red blood cells, leading to severe conditions like the hemolytic disease of the fetus or the newborn. So the destruction or the destroying of the baby's red blood cells can lead to conditions like anemia, jaundice, and in severe conditions, hydrops fetalis. It is a medical condition where the baby accumulates fluid in the tissues and the organs, leading to heart failure and eventually death. There is also stillbirth. So severe Rhesus incompatibility can cause fetal death in utero. It means that the baby dies inside your uterus. So how do you prevent Rhesus incompatibility? The trick here is to prevent sensitization. So if you know that you are Rhesus negative mother, make sure that you're given an anti-D injection. So the anti-D injection works by hiding or masking the fetal cells of the baby from the mother's immune system, preventing the mother's immune system from producing anti-D antibodies. So if the mother's immune system is not seeing any foreign body in the system or in the body, why would it produce the antibodies? So here basically the anti-D injection is hiding the baby from the mother's immune system. So the baby here is basically safe. So the anti-D is normally administered around 28 weeks of pregnancy to avoid sensitization. It is also given within 72 hours of delivery if the baby has been a Rhesus positive. Then also after a miscarriage, an ectopic pregnancy, an abortion, or even trauma in pregnancy. If there is any feeling that the fetal blood has mixed with the maternal blood, the anti-D is given. So before we conclude, I made a small chart for you here so that we can know who can marry who based on our Rhesus factor. So now these ones should not convince you they are RH. I already mentioned the other side that our blood groups are A, B, AB, and O. And our Rhesus factors are, these ones are the positive and the negative, and we all know why we have the positives and the negatives. Back to our topic. Since I'm talking about the Rhesus incompatibility, we have this. If a father is a Rhesus positive, a mother is a Rhesus positive, their child is going to be a Rhesus positive or Rhesus negative. So there is a 75% chance that your child is going to be a Rhesus positive and 25% chance. And therefore here there will not be any risk. So if a father is a positive and a mother is a positive, there will not be any risk. These two can get married to each other. So here if you have blood group A positive, blood group A, B positive, marry each other because your Rhesus factors here are the same. Then we go to the second one. Father is a Rhesus negative, mother is a Rhesus negative. They'll have a child who is a Rhesus negative. Still, there will not be any risk because now these ones, all of them, look at them. They're like triplets. So definitely negative, Rhesus negative, child Rhesus negative, there will not be any risk. So also these ones, That's why I told you at the beginning when I was talking about the Rhesus incompatibility. If a woman is a Rhesus negative, make sure that your husband is also a what? A Rhesus negative. We go to the third one. The father is a Rhesus positive. The mother is a Rhesus negative. Then they will have a child who is a Rhesus positive. This is what I've been explaining throughout this whole Rhesus incompatibility thing. This is what I've been explaining. Remember that the woman is the one that carries the baby. So if the woman is a Rhesus negative and the child is a Rhesus positive, what do you think will happen when blood mixes from the fetus and the mother? This is where we are going to have risk for Rhesus incompatibility. I've been talking about this from the time I started talking about Rhesus incompatibility. A woman who is a Rhesus negative should not get married to a man who is a Rhesus positive, because the high chances that the child is going to be a Rhesus positive and you're going to have Rhesus incompatibility, meaning that if by any chance there is trauma and the baby's blood mixes with the mother's blood, the mother's antibodies are going to attack the baby, and you will lose this baby if you have not taken the necessary medical measures. Like, for example, if you have not been given the anti-D injection, you're going to lose this baby. So here, if a woman is negative and the man is positive, don't get married to each other. Don't get married to each other. Let this woman look for negative. So lastly, we are looking at Rhesus negative. A father is Rhesus negative, the mother is Rhesus positive. So there are also high chances that the baby, the 75%, the baby is going to be Rhesus positive, and 25% that the baby is going to be a Rhesus negative. But still here, there is no risk. But even if the baby is a Rhesus negative, as long as the mother is a Rhesus positive, first of all here, the mother's immune system will not react with the babies. And also another thing is the baby's blood amount is very, very little. Therefore, the baby's antibodies cannot destroy the mother's antibodies. However, the mother's antibodies can destroy the baby's antibodies, because now remember, the mother has more blood, therefore more antibodies. If a mother is a negative here, they can destroy this baby. They can kill this baby. But a baby cannot destroy the mother. And remember that this negative here, it is the one that is always attacking, because for it doesn't have the anti-D. The anti-D is foreign to it. Therefore, the negative is the one that is always attacking. But in this case, it will not be successful because of the reason that I've given you. So that is it. That is it for you. This is the summary that I made for you. Look at it very well and see who you can marry. But this one and this one, stay away from each other so that we do not have problems of kids dying all the time, miscarriage after miscarriage. But then I also have told you what to do if you fall in love with each other. I've told you what to do. Make sure that you visit your gynecologist. Give your gynecologist all the information that is possible, that is available about you, so that you can have your babies saved, or else you're going to have issues. In conclusion, the Rhesus incompatibility is a serious matter, and this should be addressed immediately. If you're a Rhesus negative mother, make sure to receive the anti-D injection so that you can prevent formation of antibodies that could attack your baby. And if you've had any previous miscarriages, abortions, ectopic pregnancy, make sure that your gynecologist knows this information so that you can take the necessary medical steps moving forward. I remain Samantha Tabiramo. Don't forget to like the video and share it to whoever may need the information. Stay happy and healthy. See you in my next video.